Adding a few drops of peppermint oil to regular Vaseline creates a mixture that works when many expensive medications fail. I'm sure you'll feel some regret that nobody told you about this before. See, here's what most people don't realize. Peppermint oil is about 44% menthol. And menthol is not just a nice smell. It's a compound that physically interacts with your nerve cells. It activates something called a TRPM8 receptor, which is basically your body's built-in cold sensor. When menthol hits that receptor, it triggers a cooling signal that travels to your brain. And here's the clever part. That cooling signal essentially crowds out the pain signal. Your brain can process both at the same time, sure, but the cooling gets priority. It's like turning up the radio so loud you can't hear the traffic noise anymore. Scientists call this the gate control theory of pain. And it's not theory anymore. It's been confirmed in published studies. Now, the Vaseline. This is where it gets smart. Petroleum jelly is what dermatologists call an occlusive. It creates a barrier on your skin that prevents moisture from escaping. But recent studies have found it also penetrates into your outer skin layer and helps whatever you mix into it absorb more effectively. So when you mix peppermint oil with Vaseline, you're doing two things at once. The Vaseline dilutes the oil so it doesn't irritate your skin, and it traps the menthol against your body for hours instead of letting it evaporate in minutes. That means whatever benefit the peppermint delivers, it's delivering it longer and deeper than it would on its own. Okay, so 5 health issues. Let's get into the first one. And this is the big one, joint pain, specifically knee pain and arthritis. If you're over 55, I probably don't need to describe this to you. That morning stiffness where your knees feel like they're full of sand. The way you negotiate with your body just to get down the stairs. You've been told it's just arthritis. Take your Tylenol, manage it. But here's what happened in a clinical trial that finished in late 2024. Researchers at Shahid Beheshti Hospital took 120 patients with knee osteoarthritis. They split them into 3 groups. One group got a peppermint oil knee massage twice a week. Another group got the same massage but with plain paraffin oil, basically a placebo. And the third group got nothing. 4 weeks later, the peppermint group showed significantly better results in pain reduction and physical function than both other groups. And that's not the only study. A 2021 trial published in BMC Complementary Medicine tested peppermint oil on osteoarthritis and found that it reduced pain markers, increased antioxidant activity in the joint, and even improved what the cartilage looked like under a microscope. That's not just masking the pain. That suggests it's supporting the underlying health of the joint, not just masking symptoms. Now think about what happens when you add Vaseline to this. You rub the mix onto your knee before bed. The Vaseline locks it in. While you sleep, the menthol keeps working on those TRPM8 receptors in the tissue around the knee. It's increasing blood flow to the area because menthol is a vasodilator. More blood means more oxygen, more nutrients, more repair, and your body does its best repair work between roughly 10 p.m. and 2 a.m. anyway, so you're stacking the timing. Now here's where I started to get really interested. Because the second thing this mix can help with has the strongest clinical backing of anything I've seen for a natural remedy. And that's headaches. I want to tell you about a study that kind of blew me away. Researchers took 41 patients with tension-type headaches and treated 164 headache episodes. This was a double-blind, randomized crossover trial. They compared a 10% peppermint oil solution applied to the forehead and temples against 1,000 milligrams of acetaminophen. That's 2 extra-strength Tylenol. The result? The peppermint oil reduced headache intensity significantly within 15 minutes. And here's the part that got me. There was no statistically significant difference between the peppermint oil and the acetaminophen. The results were remarkably similar. In this study, the oil showed effectiveness comparable to common painkillers. That study was so convincing that Germany actually licensed 10% peppermint oil as an official treatment for tension headaches. It's in their medical guidelines for adults and children over 6. And it's not just tension headaches. A double-blind trial on 120 migraine patients compared peppermint oil nasal drops with lidocaine, which is a pharmaceutical anesthetic. The peppermint oil reduced the intensity and frequency of migraines at a level comparable to the lidocaine, a plant extract going head-to-head with an anesthetic drug, and performing the same. The mechanism makes sense, too. The menthol relaxes the muscles around your skull, the pericranial muscles. It increases blood flow to your forehead, and it directly inhibits the pain receptors. When you mix it with Vaseline and rub it on your temples, the Vaseline keeps the menthol from evaporating, so you get longer relief. Without the Vaseline, the peppermint oil is gone in maybe 10-15 minutes. With it, you can feel the cooling for an hour or more. All right. The third one is the one that, honestly, the first time I tried this, I felt a little silly. But then it worked so fast I couldn't ignore it. Sinus congestion and breathing. Now think about this for a second. What is the main active ingredient in Vicks VapoRub? Menthol. What is the main active ingredient in peppermint oil? Menthol. You're basically making a DIY version of a product that's been on pharmacy shelves for over 100 years. Except yours has actual peppermint oil and not synthetic fragrance. When you inhale menthol, it activates the same TRPM8 cold receptors inside your nasal passages. This triggers a cooling sensation that makes your brain perceive more airflow. Your nose isn't physically more open, but the sensation of stuffiness dramatically decreases. And that perception of improved breathing, that's not some placebo thing. It's a documented neurological response. A review published in PMC found that menthol inhalation reduces coughing frequency and the sensation of nasal congestion through these specific receptor pathways. Here's where the Vaseline angle gets really practical. You mix a couple drops of peppermint oil into a small amount of Vaseline, rub it on your chest before bed. The Vaseline slows down the evaporation of the menthol. That means you're inhaling a low, steady concentration all night long as you sleep. Not a blast that fades in 5 minutes. A slow release, like a time-release capsule but on your chest. And for anyone dealing with seasonal allergies or chronic congestion, a 2022 study found that peppermint oil improved symptoms of allergic rhinitis, including sneezing and upper airway inflammation. Now, before we continue, let me be straight with you about something. I'm sharing published research with you, clinical trials, peer-reviewed studies, but I'm not your doctor. And everybody's body is different. What I'd encourage you to do is bring this information to your next appointment. Show your doctor the studies. Let them weigh in on your specific situation. Because the goal isn't to replace anything. The goal is to add something that might actually help. Okay, number 4. And this one hits close to home for a lot of people who watch this channel. I know, because the comments tell me. Night leg cramps and muscle spasms. You know what I'm talking about. You're dead asleep at 2 in the morning, and suddenly your calf muscle seizes up like somebody grabbed it with a vice. You're trying to stretch it out, you're walking around the bedroom, and 20 minutes later, you're still feeling the ghost of that cramp. Research suggests that over 60% of adults over 65 experience nocturnal leg cramps. 60%. That's not a rare condition. That's basically the norm that nobody talks about. So here's why peppermint oil mixed with Vaseline is interesting for this. The menthol does 3 things at once. First, it's a natural antispasmodic. It blocks calcium channels in the muscle tissue. Calcium is what triggers the muscle to contract. Block the calcium entry, and you interrupt the cramp at the source. A study in PMC confirmed that menthol has this calcium channel blocking ability, specifically in smooth muscle tissue. Second, menthol is a vasodilator. It opens up the blood vessels. For cramps that happen because of poor circulation in the legs, and that's extremely common after 60, improving blood flow can be a game changer. Third, the anti-inflammatory effect. A comprehensive meta-analysis of randomized controlled trials found that topical essential oils, including peppermint, significantly reduced musculoskeletal pain intensity compared to placebo. And the strongest effect was immediately after application. You rub this mix on your calves before bed. The Vaseline keeps it working while you sleep. Some people feel a difference the first night. For others, it's a few nights before the cramps start spacing out. But the mechanism is sound. You're addressing the spasm, the circulation, and the inflammation simultaneously. All right, number 5. This is the one I saved because, honestly, I think it's the most important. And it's the one almost nobody would expect from peppermint oil and Vaseline. We're talking about nerve pain, neuropathy, that burning, tingling numbness that so many people live with, especially in the feet and hands. About 25 to 50% of people with diabetes develop peripheral neuropathy, and diabetes is incredibly common in people over 60. But it's not just diabetes. Neuropathy can come from chemotherapy, from injuries, from age-related nerve deterioration. And here's the frustrating part. The standard drugs for it, things like gabapentin or pregabalin, they take weeks to work and come with a long list of side effects: drowsiness, dizziness, weight gain. A lot of people just live with the pain because the treatment feels worse now. In 2002, researchers published what they called a novel treatment of postherpetic neuralgia using peppermint oil. A 76-year-old woman who had not responded to any standard therapy. Nothing was working. They applied peppermint oil topically to her skin. She reported rapid and significant relief that lasted 4 to 6 hours. The researchers wrote, and I'm not paraphrasing here, this was the first evidence of peppermint oil having a strong analgesic effect on neuropathic pain. Then, in 2015, a proof-of-concept study at a specialist cancer center tested 1% menthol cream on patients with chemotherapy-induced peripheral neuropathy. Applied twice daily. The result? Significant improvement in pain scores. The effect was rapid. No dose titration needed. No apparent side effects. The American Society of Clinical Oncology later acknowledged topical menthol as a, quote, promising agent for this type of nerve pain. Here's why menthol works differently for nerve pain than it does for, say, joint pain. In normal tissue, TRPM8 activation gives you a nice cooling sensation. But in damaged nerves, those TRPM8 receptors are actually upregulated. There are more of them. And when menthol activates those extra receptors, it triggers your body's endogenous opioid system, your own internal painkillers. Specifically, it engages kappa opioid signaling pathways. So you're not just covering the pain with a cooling sensation. Your body is literally producing its own pain relief chemicals in response to the menthol. That is a fundamentally different mechanism than any over-the-counter painkiller. And it happens through your skin. No pills. No systemic side effects. Now, let me tell you exactly how to mix this properly, because getting the ratio wrong is the #1 reason people try this and give up. You need pure peppermint essential oil, not peppermint fragrance oil, not mint extract. Look for mentha piperita on the label. If it doesn't say that, put it back. Start with about a tablespoon of Vaseline, regular, unfragranced petroleum jelly. Add 3 to 4 drops of peppermint oil, not 10, not 15, 3 to 4. Peppermint oil is potent. Mix it well with a clean spoon or your finger. Do a patch test first. Put a small amount on the inside of your wrist. Wait 30 minutes. If there's no irritation, you're good. Some people can handle 5 or 6 drops per tablespoon. Some people do better with 2. You'll figure out your level pretty quickly. For joints and muscles, apply directly to the area and massage gently. For headaches, dab a small amount on your temples and forehead. For congestion, rub on your chest. For nerve pain in the feet, apply to the soles and tops of your feet and put on cotton socks. And here's a tip that makes a real difference. Your skin absorbs better when it's warm and slightly damp. So the best time to apply this is right after a warm shower before bed. Your pores are open, the Vaseline seals everything in, and you get the maximum overnight benefit. Store the mix in a small glass jar with a lid. It keeps for weeks. Make a fresh batch when you notice the peppermint smell has faded. One thing I want to mention, Peppermint oil is generally very safe for adults when used topically and diluted. The National Center for Complementary and Integrative Health confirms this. But avoid putting it near your eyes. Don't use it on broken skin. And if you're on any medications, especially blood thinners, just mention it to your pharmacist. Takes 30 seconds and gives you peace of mind. Think about what we just covered. 5 problems. Joint pain that a clinical trial showed responds to peppermint oil massage. Headaches where the oil matched acetaminophen in a controlled study. Sinus congestion where the mechanism is so proven it's in products on every pharmacy shelf. Muscle cramps where the calcium channel blocking, the vasodilation, and the anti-inflammation all work together. And nerve pain where the research is so compelling that an oncology society took notice. 2 ingredients, a few dollars, 5 minutes before bed. This is not about miracle cures. It's about giving your body something that published science suggests has real potential to help. And doing it smartly, with the right mix, the right method, and the right expectations. If this was useful, hit subscribe. Every video on this channel is built on published clinical research, not trends. Hit like so the algorithm shows this to someone who might be rubbing their knee right now wondering if there's something they haven't tried. And drop a comment. Tell me which of these 5 you're going to try first. I read every single one. Share this with someone who's been dealing with that 2 a.m. leg cramp. Someone whose fingers go numb. Someone who takes 4 Tylenol a day and wishes they didn't have to. Your body has more options than you've been told. See you in the next one.